What's going on, y'all? My name is Eli, and welcome back to my YouTube channel. So, today we have another episode of our residency series. I'm going to keep the intro very brief because this is now the third episode. You probably know what the series has been about. If not, make sure to check out the playlist. It has the first two episodes in there, the endo residency vlog and the OMFS residency vlog. Today we have the Pediatric Dentistry residency vlog brought to you by Dr. Dan Boateng. Dan graduated from Tufts University. He was actually still in Boston last year when I was a first year. So that's how I know him. I reached out to him because I knew he was in pediatrics residency, and also I really do try to get more men on the channel. It's just always women that want to vlog. I can never find a man that wants to vlog that can fit into one of these series that I have. So shout out to the very few men that have volunteered to do a video on my channel. Spoiler alert, I'm pretty sure every other resident that I have is a woman. So thank you so much, Dan, for recording a day in your life in pediatric dentistry. One thing I didn't know, but I probably should have known, is that I guess maybe not at all pediatric residencies, but at the one that Dr. Boateng is at, they take call in the hospital. So I thought that was pretty cool. He explains a little bit about his call schedule and stuff. And yeah, without saying much too more, of course, if you're new to the channel, please make sure you subscribe, like the video, comment under the video, and share the channel with anyone who might find it interesting. So without further ado, here's the vlog.
What's going on, guys? My name is Dan Boateng. Should I say Dr. Dan Boateng? I'm still not used to that, so we're gonna go with Dan. And I am a PGY1 here at the NYU Langone Pediatric Dentistry residency here in Providence, Rhode Island. Yeah, Eli reached out, told me about this amazing series he was doing on YouTube, giving insight into the day of the lives of different dental students, different residents. So I said, definitely, why not? I'd love to give my perspective on what a day in my life looks like as a pediatric dental resident. So yeah, so you're gonna see me look here real quick. I'm just kind of reading off some of these points that Eli gave to me, and if I mess up, we're just gonna flow. All right, we're not gonna cap or fluff for the video. So brief introduction of who I am. Like I said, my name is Dan Boateng, born and raised in Jersey, of Ghanaian descent. I got my undergraduate degree at Rutgers University, and got my bachelor's in what did I get my bachelor's in? Public health, and a minor in Africana studies. Then I got my master's in biomedical science at Rutgers Graduate School. Got my dental degree at Tufts University School of Dental Medicine up in Boston. And now I'm here getting my certificate in pediatric dentistry at NYU Langone. So what piqued my interest in peds? I feel like the population that I've always worked with, volunteered with, done mission work with, was predominantly children. I've always loved the population. I love the joy that kids bring, for the most part, to the day. Their innocence, their energy, it's infectious. It makes the day go by a lot quicker. And it's just fun to be around. And having those experiences definitely shaped my desire to specialize in this field. It wasn't always a dream of mine to become a pediatric dentist. I won't sit here and lie to you and act like this was destiny, but when you look back at it and you see the steps, when I see the steps that I've taken, I think this was always going to be the path for me. And I'm glad that God has placed me here. How did I decide on this program? Well, Tufts Dental gave us the opportunity to extern at different sites across the area, and my externship happened to be here at the Rhode Island site. So I was here for 5 weeks, and I loved every aspect of it, honestly. from the director to the program coordinators to our lead dental assistants, the entire staff, the residents, man, everyone was so welcoming. And I learned a lot, not only about pediatric dentistry, but about myself in those 5 weeks. And it really confirmed for me that this was the journey that I wanted to take. So it was a no-brainer for me. And God blessed me with the opportunity to match here. It was my top choice. And I'm 6 months in, and I'm honestly still loving every aspect of it. Some of the things I've been able to see, mind-blowing. Sometimes I sit back and think, I can't believe that I get to do this, whether that be just treating in the clinic or on anesthesia rotation, on hemonc rotations, various rotations that I'm on, and taking a step back and realizing, like, wow, I'm really here in this moment. It's been an absolute blessing, honestly. So yeah, that's why I chose this program. I love it. I've got a year and some change left, and I'm looking forward to, perfecting my craft on a daily basis, learning more information. There's a lot about pediatric dentistry that I did not know in Tufts, to be very honest with you. And I'm glad I have this opportunity here to learn more and become a specialist in what I do. So yeah, you guys will follow me on this journey today. I've got a lot. I'm on call. I'm in the OR tomorrow. We've got board review. So you'll get a good mix to see of what I do on a daily basis. And just a little bit more about my program. So my program is 2 years. It's a 2-year residency program. We learn various things from obviously treating pediatric patients, but also the developmental things that come with the pedo population. It's just not a set of teeth. You have to learn various disorders, various diseases, various conditions, a multitude of things that I kind of overlooked, to be honest, in dental school. A lot of pathology, a lot of medicine, and being able to treat these patients. So it's a lot, but I'm taking it day by day. I see new things every day, and I'm super grateful for that. So like I said, I'll show you a lot, and yeah, we'll kick it off tomorrow morning and we'll go from there. Peace. See you in the morning.
Morning, guys. So it's 5 a.m. It's about like 5:15ish. Got up, took a shower, and I'm just getting ready to head to the hospital where we do our GA cases. So typically I try to get there around 6:15, 6:30 because our cases start at 7:30. So just prepping for that. My mornings are pretty straightforward. I just get up, try to eat breakfast sometimes, but I'll be honest with you, I'm not gonna cap for the video. I didn't make breakfast today. Sometimes I do, sometimes I don't, but when you're up this early, at least when I'm up this early, I'm not interested in eating. I just kind of want to get there. Yeah, I'll take you along and I'll show you just a bit of what we do. The day of surgery, prior to surgery. It's a busy day, on call, have GA, and we have board review. So I'll try to walk you through the entire day with me. Yeah. Let's go ahead and get this day started. All right, well, as you can clearly see in the video, we've got our first snowfall. So today's commute is gonna be pretty interesting. Almost positive I don't have something to clean my car with, but we'll see how it goes. All right, guys, so I made it to the hospital. I'm a bit early. I've got about 10-15 minutes before we start prepping and getting ready for our cases this morning. So what I'm gonna do in the meantime is work on my call log. We had a patient, we had a call for a patient yesterday who had that trauma. So we have to send out a call log for each patient that we see in the ED. So I'm gonna work on mine from last night,
and then I'll start prepping some of the charts and paperwork for our patients this afternoon. Well, sorry, this morning. Yeah, so let's get started. All right, guys, so we are in the OR. It's a pretty busy day for us. We have 3 cases today, and they all have a variety of things that they need. So let's quickly go over why someone might be referred to the OR. There's several indications why a patient might be referred. Typically, we have a patient who has multiple quadrants of dentistry that need to be completed. And doing this in the office can be a challenge at times. As you know, with pediatric patients, it's imperative to have great behavior management. But if we can't control that in the clinic, we opt to bring them to the OR. So if we've had a failed nitrous appointment, or we have documented behavior disorders, or someone with a medical condition such as autism, these are all great indications to have them seen in the OR under general anesthesia. So what that looks like for our patients, we'll bring them and their parents or guardians back into the pre-op area, and we'll go over everything what the day is going to look like. As far as the anesthesia team coming in, the nursing team come in, and the dental team come in, we'll all cover what we're going to do for them that day. So we explain to them any teeth in the back that have cavities will get silver crowns. Any teeth in the front that have cavities will get white crowns. Essentially, that means they'll get a stainless steel crown on their molars, and any interior teeth will either get composite fillings or get strip crowns, just depending on the extent of the decay. Should the decay extend into the nerves, we'll go ahead and do a pulpotomy for them and put a stainless steel crown on top. And should the caries be so extensive that the tooth is non-restorable, we'll go ahead and extract and place a space maintainer there, allowing room for the adult teeth to grow in. And this all just depends on what tooth is coming out, the type of space maintainer that might go in, whether it's a banded loop or a distal shoe. Yeah, it's pretty straightforward. Patient comes in, anesthesia team will give them a mask, typically with sevoflurane, help them go to sleep, and then while they're asleep, they're managed with a variety of drugs with that. Sorry about that. Whether that be propofol, fentanyl, we have our emergency meds, succinylcholine, our atropine, our epinephrine. So there's a good amount of drugs that go into monitoring the patient and making sure they're safe here. So yeah, so that's just a quick debrief. I'm actually going to go pre-op our patient right now, so I'll check back in with you when I am scrubbing it. So this is our dental suite in the OR. We've got the anesthesia set up here. We've got our mobile dental cart, all our x-rays and instruments set up. So it's a pretty nice setup. We're fortunate to have our own suite here in the hospital. So this is where our OR takes place. All right, so our patient is all checked in. Pre-op is done. Nursing team's gone in, anesthesia team's gone in, and the dental team's gone in. So for our patient here, we're gonna do an 8-pack with some strips and a couple composites. So what an 8-pack means is all 8 molars are getting stainless steel crowns on them. D and G are getting strip crowns, M and R strip crowns as well, and E and F are being extracted due to non-restorable caries. Non-restorable tooth due to caries. So yeah, it's a pretty straightforward case. It should take about an hour, hour and a half, just depending on how this goes. So yeah, I'm gonna go ahead and get started, scrub in, and yeah, see how it goes from there.
I got it. I have no clue, honestly.
All right, so we just finished our third and final case. Pretty busy day, but they're all straightforward. A variety of things each patient got, but we were pretty successful in our timing today. And that's what we're really trying to focus on. Not only getting better at what we do, but becoming more efficient with our time. Yeah, because this is how private practice is going to be. You really do well based on how much you can do, how well you can do it, and how fast you can do it. So got a little better today. As far as what's next for me, I'm going to grab something to eat. On Mondays, we have a board review at the clinic with one of our attendings. So I'm going to grab something to eat, and then we'll head over to the clinic and knock out board review as well, all right? All right, so I'm walking out of the OR now, headed to clinic. Typically, we do wear scrubs every day, but I knew I wouldn't be seeing patients in the clinic today just because of timing, so I'll wear something a little bit more comfortable. But yeah, gonna grab some food real quick, head to the clinic, knock out these board reviews, and then we'll go from there, all right? All right, just wrapped up. Even, luckily for us, we don't pay. Just go ahead and swipe. We're all set. So I'll see you guys when I get back to the crib.
Wow, so that was a very interesting vlog. Shout out to Dan. He definitely recorded a lot of his day, did a good job explaining what his residency program was like and what led him to pediatric dentistry. I found it to be very entertaining as well as informative. If you have any questions about pediatric dentistry residency, please make sure to reach out to Dan, and I'm sure he'll be happy to answer any questions that you may have. Of course, once again, please make sure you like the video, comment under the video, subscribe to the channel, share the channel, all that good stuff. It helps a ton. And yeah, be on the lookout for more vlogs coming soon. More of the residency series is coming up next. More day in the life, Q&A video coming soon. And, you know, just more stuff. I'm not going to lie, like, I've been trying to just focus on school for a little bit. I love vlogging. I love YouTube, everything. But, you know, I don't want to be super repetitive with y'all. So I am trying to be a little more creative about the type of videos I make, etc. Like how much how much caffeine I consume per day. I'll address that in another video, by the way. And, yeah. You know, just stick around. We're going to have a good time. Second semester of second year dental school, which means this is the year that I start seeing patients. We can get into all that in another video as well. Let's keep this one strictly about residency. So thank you, Dr. Boateng. Thank you for watching. Everyone else, please reach out if you have any questions, and I'll see y'all in the next vlog. Peace.